Hello, everyone. Welcome once again to another episode of the Empowering Patients podcast, your weekly take on all things related to new care models in healthcare, remote patient monitoring, chronic care management, and hospital at home. I'm your host, Theo Harvey, and I'm the CEO of SensorMed, the leading full service RPM platform in the industry. Today, I have on the podcast Kornelius Bankston. Cornelius is the managing partner of techPLUG. He leads the firm's strategy and business development efforts. He's a graduate of Morehouse College, Emory University, and Georgia Institute of Technology. He also serves as a mentor for Techstars and is a member of the advisory board for Pain Care Labs, a virtual health council member at Tulsa Innovation Labs, and chairperson of SE Color. Most recently, Cornelius served as the director of business development for Color Genomics, leading the company's Southeast business development efforts. And Cornelius leads strategic partnerships for Simple Health Kit, a social impact diagnostic company located in Silicon Valley. Hey, Cornelius, welcome.
Hey, man. Thank you, man. Thanks for having me.
All
Appreciate it.
right, great. So, thank you. So, typically, what we do here, Cornelius, thank you for joining the podcast. We like to cover a different topic, news topic, and I thought since today we're going to be covering health equity and talking a little bit about this, since this is Black History Month. One of the
Okay.
things that a news story that came into my mind was Walmart. Looks like
Okay.
Walmart is getting COVID-19 vaccination, into underserved areas pretty effectively. So there's an article that said, their vaccination schedule, they're doing pretty well. They said 80% of doses went to medically underserved areas as defined
hmm
by HRSA, which does
hmm
give you a sense of their opportunity in more general primary care delivery.
hmm
So, what are your thoughts about Walmart and what they're doing with getting COVID-19, doses out to patients who are individuals who need it the most?
Yeah, I think it's a tremendous effort. Kudos to the Walmart and the Walmart Health team. As you know, we partnered with Walmart in some of those efforts to get testing and vaccination into vulnerable, marginalized communities. I think one of the strategies in which we were part of with them that has been beneficial is they really understand the community. They really understand because their stores are in some under-resourced and underserved populations, and so they built connectivity into those ecosystems and understand the challenges, and therefore, in understanding the challenges, they know how to deploy those solutions into those said communities. So amazing effort. Kudos to the team for being able to drive vaccination rates in those communities.
Yeah, great. And this reminds me of another story I saw, like Dollar General was looking at,
hmm
the healthcare space. So
hmm
these spaces that we typically don't think of as healthcare spaces,
hmm
retail environments in
Yeah.
rural or underserved communities, could these be, center, kind of hub centers for healthcare for the communities? I'm curious, that's kind of like my
hmm
thought around this.
Yeah, yeah. I think that's the way to go because they've been there for years. Dollar General have been in under-resourced, underserved. That's their market. And so if they can then couple that with health services to reach people within the community, I think that is, definitely think that's the way to go.
Mhm.
Family Dollar, General Dollar, all of those stores, those retail stores that serve those in those communities, I think it would be advantageous of them to figure out ways how they can provide medical care to those most vulnerable populations. Yeah.
Yeah, I totally agree. And one of the
hmm
things I also know, Walmart was in the early phases of, for the unbanked, right? Having
hmm
ability for them to come in
Yes.
for banking
Yes.
services as
hmm
well. So,
hmm
it's just, providing, it looks like, care is trying to get as close to people as possible. And I
Yeah.
think something like a Walmart is, within roughly what, a couple of miles of every American in the United States. And so
hmm
having that, that's probably closer to most folks than go and see their doctor, right? Which,
Right.
long period
Right.
of
So,
time.
because if you think of some of these rural communities, they have a Walmart and they probably have one hospital, right? And that hospital serves as a primary care facilities for some as well. So individuals go to the emergency room. The data show that people will go to the emergency room first. But if these retailers that have a footprint in some of these remote communities, urban centers that are underserved, and have health care there, I think it's a win-win type of opportunity because most people will go and get some food at a Walmart, or, get their, supplies there, toiletries, etc. I think it'll be an amazing opportunity for them to continue to engage on that level from those types of centers.
Yeah, I love it. So yeah, more of that, and
Mm-hmm.
more innovative ideas like that. Hopefully, will come to the forefront as we saw the pandemic really
Mm-hmm.
saw the disparities increase, and so having these
Mm-hmm.
partnerships with these organizations and that are closer to the people, I think, be huge.
Mm-hmm.
And so, well, more of that, man. So I'm really excited about that. So let's
Yeah.
transition a little bit into kind of asking you as the kind of our resident expert here on health equity and what you've seen with it.
Oh.
Just wanted to get a sense of
Hello.
your thoughts about where you see it's going. I know you've been really passionate about this. As a matter of
Mm-hmm.
fact, you can talk a little bit about techPLUG later and what you're doing there
Mm-hmm.
when it comes to
Mm-hmm.
providing diverse innovation to healthcare. But
Mm-hmm.
one of the questions I want to ask, as you're thinking about this and working with your partners, what do you see are the
Mm-hmm.
keys to successful healthcare program in underserved areas? What makes
Mm.
the program successful for individuals who may not get the best healthcare now or looking for access to healthcare?
Yeah, that's such a loaded question. I got so many thoughts around it. I think what we have learned from COVID. You have been on this health equity train well before COVID and have understood the challenges, and so have I. And so what we have learned through COVID is, reaching people where they are. Putting, as we had mentioned earlier, putting centers close, because as we know, these social determinants of health, transportation issues. Some people don't even have Wi-Fi access. And so learning through all these things that we had to grow through and learn through during this pandemic, and creating spaces where individuals have lower barriers of entry in order to get the care. And so when we think about health equity, it's like really addressing those social determinants of health. And one of them is proximity to care. One example I think of, here in New Orleans, example is there is a hospital in New Orleans East. They do not have a labor and delivery service arm. However, it serves a large Black population. And people are having babies and they have to drive 30 miles out in order to get care. And so that just leads into the point of actually getting care in a closer proximity to individuals who might have challenges as it relates to transportation. And now, since we're living in this digitized world with um, Wi-Fi capabilities and not having 5G in some areas, we really have to think about how do we get care as close as possible, proximity, not just technology, but actually having physical structures that are close so individuals don't have so many barriers to get there. And so, broadly, I think that is one of the issues in which we're facing as it relates to closing this gap in health equality. We can talk through digital solutions, but you can't have digital solutions if you don't have Wi-Fi or 5G capabilities. And so when you think about not only people in, you know, urban centers, but when you think about people that lives outside in rural America and not being able to have fiber optic capabilities that reach their place. I got an example with a client out in Alabama where the lady is driving to individuals' homes in remote Alabama to provide care as it relates to maternal care,
Mm,
because the lady's about to give birth. And so, reaching people where they are. So I think we're in this space and to get care as close as possible with people and figuring that out in this technology revolution. I think that's where we should go. We can continue to talk about interoperability challenges. I was a fan of this back when we were talking about fintech when I was in Atlanta. It's like if the banking industry can figure out how to transfer information from different or multiple banks or even through Cash App, how can we not start thinking about that in the same context as health and delivering data from
mm.
multiple hospital systems through different payer groups in just a click of a button as we do on with our transfer and dollars. I think we're there. We just got to figure out how to do that in a more creative way and apply that to healthcare.
Mhm. Now, a great point. I
Mhm,
think access to care is really big and critical
mhm,
for the type of programs for the underserved communities. One thing
mhm,
I am challenged with is just understanding healthcare. It is that people element, right? And so
mhm,
having those people closer to where people live. I've
mhm,
seen a lot of digital health companies looking at providing individuals to the home, and
mhm,
providing that help right there
mhm,
where they live.
mhm,
Do you see those programs being successful? Like, to help with the access, to be able to have
mhm,
individuals come to people's home,
mhm.
is that something you see as positive or a way in the
I
future?
think so. I think we're going back to the days of old where your physician would actually come to your house to provide you with care, and I think that's amazing. We're armed now with technology. If you think about Uber, you know 5 years ago, you would not have thought to get in a random person's car in order to get you someplace, right? And then now thinking about, okay, how can we use this gig economy or this gig kind of structure in order to get care directly to one's home? And so we're seeing that with Everlywell, right? We see that with 23andMe, where you can actually, well, more with Everlywell, you can take a test, they get you shipped to your home, you have to leave your home, they provide you with the results, and then you can get care through telemedicine. And then two, now I think to your point, actually getting a provider to actually come to your home to do that assessment. I think we're living within that reality because some individuals are really afraid to leave their home in this pandemic. It's still ongoing, and individuals trying to figure out how to survive and get the things they need. We've seen an uptick in Instacart. We've seen an uptick in a lot of these solutions that provide care or services directly to one's home. So yeah, I think that makes complete sense, particularly in the times in which we're living.
No, I love it. Well, let's take a step back. Obviously, there's been record funding, into digital health, more specifically, with, 2020, and we saw the protests from the George Floyd and other things that happened, in the community. Tons of money has went into, health equity, right? Trying to figure out how to solve this problem because unfortunately, the vast majority of, underserved communities were hit the hardest by,
Mm-hmm.
COVID, right? Record numbers of individuals dying from it.
Mm-hmm.
So, what do you see, now that we have this money here and that's helping in some aspect, what would you like the future of health equity going, with this additional funding resources, ability to
Mm-hmm.
kind of help patients where they live? Where imagine, if you will, right? You had a paintbrush and could, paint the
Mm-hmm.
future. What would that look
Mm-hmm.
like to you when it came to helping underserved communities?
Well, I'm a big fan. I've been this way since I was in grad school at Emory. I believe that individuals innovate and solve problems based on how they have experienced life. And so, with the influx of capital, however, I give a caveat with Black founders and Black health tech founders, there's still opportunity there in order to get more dollars to them. Um, as I think I was talking about this the other day, we're over mentored and underfunded
Mhm.
compared to our counterparts, right? And so I believe, and people, say whatever they want to say about me, but I believe based on your experience, that's how you solve problems. So example, kid living in, South Central LA, parents have experienced diabetes. He sees the challenges in which that community face. I think that he could potentially have a solution, right? But he need the resources, i.e. capital, to actually help him to address those problems. I believe that there should continue to be a funnel of money that's going directly to founders of color to help address some of these concerns because we have a unique way of looking at some of the systems that are in place that are impacting our communities, that are driving individuals not to go into the system. So, I think it's a real touchy subject with me. Now, we see a lot of commitment. We haven't seen a lot of flow of dollars related to, this whole movement that we're in around Black Lives Matter and, promises by large corporations, et cetera. I think there's still a lot of work to be done. And I think that it needs to be done in a very strategic way. And that strategic way is, how do you get founders of color that have experience to get these dollars in order to get them over these humps, in order to get the solutions to people that need it most?
Mm.
That's my thought around what should be done with these dollars. Like, not tomorrow, but like today.
No. I read some articles about, health equity researchers, right, who've been in this
Hmm.
space for, decades,
Hmm.
struggling to get dollars too, even
Hmm.
though newer researchers who may, come from majority backgrounds,
Hmm.
i.e., white researchers may have gotten the money instead. So it is unfortunate, to your point. I agree that
Hmm.
if you see the world a certain way, you have a solution. So you're more passionate about that problem, probably. You're going to be more
Hmm.
creative in solving that problem. So why the dollar should go to that person that has that energy, the understanding, because they'll probably solve the problem the best way, right? Because they experienced it. And so,
That's it. That's it. That's it. That makes sense. When we talk about developing the solution, you develop the solution based on your experience. And so what we lead with in techPLUG is, you got to develop culturally relevant solutions, especially in this age where people are not going into the doctor's office.
mhm.
How does that work in these communities that are under resourced and underserved? You know, Yeah, man. I'll start preaching, so I'll calm down because I'm like, let me breathe.
No,
I'm
this is
excited.
great. I
Yeah.
appreciate you sharing your
Mm,
passion around it. It definitely
mm,
shows. So, and
yeah.
obviously, we're passionate here at Censor, man, serving
Mm-hmm.
underserved communities. 80% of the patients on our platform are, from
Mm-hmm.
underserved communities. So
Mm-hmm.
we see the pain. I've actually been in patients' homes in Middle Georgia as they're
Mm-hmm.
cooking dinner, trying to deal with their grandkids and trying to take their blood pressure, understanding the pain, like, hey, I want to do better, but I'm struggling with all these other things happening.
Man, and that is, and so you just hit a point. When you're dealing with founders, and this is why it's so important, the work that we're doing here at techPLUG. So when you deal with founders that might be in the Bay Area, or founders of health tech companies that might be in the Northeast, right? They don't have that experience because we live in silos. We live where it's comfortable, right? And so you might live in a majority, Asian community or a majority white community in the Bay Area, but your solution is supposed to reach someone in Middle Georgia. And if you don't understand their pain point, if you haven't sat in their home or in their community to really understand what those challenges are, how will your solution meet their direct need to drive positive outcomes?
Yeah.
It won't. You'll continue to iterate and say that, they don't get it, or there's a learning curve and all these other things, but you don't understand, but one doesn't understand the community
Yeah.
and the challenges. That's the real piece here in this system, the systems that we've established. Well, not we, before us, these systems that are in place. And it's across racial lines. We live where it's comfortable for us. We live where people vibe with us. It can be past, race. It could be based on how we look at the world. And so once we get out of those silos, especially around health, this is like the thing that we're doing, that you're doing. It is not LinkedIn. It's not Facebook. This is actually health care. This is providing individuals with what everyone on this earth should have, is quality health care. And you have to get out of your silos and get uncomfortable a minute in order to get the best solution that can meet all people, opposed to people that might have it and those that don't.
Yeah, well said, man. I can't say it better than that. So,
Yeah.
well, hey, look, you
Yep.
mentioned techPLUG and what you guys are
Hmm.
doing. Tell
Yeah.
tell tell the audience a little bit about techPLUG and kind of what you're doing there in New Orleans and what your vision is there
Yeah.
for the
So
future.
I can't speak of techPLUG without speaking of SensorMed, because we've been around now for 3 years. March will be 3 years old. And Theo, you were like the first client that we had, the very first. And so, man, I appreciate you. So when nobody else knew what we were or what we were trying to do, and it's still an educational curve that people are really trying to still understand what we do. But at the heart of what we do is we help health tech founders around the country scale and grow in vulnerable populations. And it's incredibly hard work. So when you think about a company that's trying to get their first client, and that might be, and some people go right after Stanford Health, or they go straight to Emory. And I do the flip. Let's find a FQHC. Let's find a safety net hospital that we can actually, that really needs the solution, and that will really engage with the founder in order to get it to the people that need it most. And so that's the core of our business at techPLUG, and that's what we've been working on for the last 3 years. And here in New Orleans, we're at that place of inflection and scale. So we have a brick and mortar space called the Lab in Treme. And Treme is the oldest African American neighborhood in the country. And we have a health innovation center right there in Treme, to address on the ground these problems that disproportionately impact Black and Brown people and underserved and marginalized communities. And so if you can imagine people like yourself that are health tech founders that are looking to engage and looking at 3.0 of their solution, or looking to engage with health systems that really serve this community, this is the place you want to be, because we have that connectivity. You can just think, just looking at our building, Mr. John's across the street, the brother does not eat vegetables, and trying to engage him around solutions that can improve his quality of life and get him off his meds, get him safely off of medication, that he can live a more, robust life. And so that's the vision. That's what we're doing. We had our ribbon cutting on the 22nd of January. And now we're having people come in. We're still, getting the space up and running. I'm not there today because it's Mardi Gras in New Orleans. And so you go out and do Mardi Gras things. So we're working from home today. But yeah, the space is right there in Treme, man. We're excited and happy about what we're doing here in New Orleans.
Oh man, that's awesome. It's
Mhm.
exciting about. I mean, I think this is unheard of. I mean, the more I'm thinking about it, I don't know. So obviously, everyone's trying to create these centers of technology excellence, but to
Yeah.
really kind of like put it centered in an area that could use the resources
Hmm.
and have funding and have an accelerator and have access to people to kind of try the, pilot solutions. I mean, it's definitely a
Hmm.
first of its kind. So,
Yeah, man.
do of what you're doing out there, and really trying to, walk the walk, right? Because I think
Yeah.
we can change the conversation around health equity, in our lifetimes, because I think there's enough technology, enough opportunities to
Hmm.
help folks.
Hmm.
So,
That's
and I
it.
definitely
We're the
it's
change we need. We're the change that we need. If we're gonna be, we want to see change. We're the change, because if we continue to ask people to do it, they don't understand the challenges. So create it, build it, and do it. And so we wouldn't be here without you, Theo. That you were the very first
oh, well, man,
person
appreciate it, man.
to say
Appreciate it.
yes. And so we're here. We're scaling.
And of course, likewise, techPLUG has been an instrumental helping
Mm,
Sensor Man with marketing efforts
mm.
and things of that nature,
Yeah.
and connections. So this is a
Mm.
win-win. And so, definitely,
Yeah.
Cornelius, any way anyone can reach you, or if they want to follow up or have questions about techPLUG or just what you're doing there in New Orleans.
Yeah, yeah, sure. Our website is www.techplug.tech. That's techplug.tech. And there you have to click on the little icon if you want to reach out to us and learn more about what we're doing. I'm on Instagram, but that's probably not the best place. So we could probably look at me on LinkedIn, and just my name, Kornelius Bankston, is a good way to reach me as well.
Awesome. Great. Well, Cornelius, thank you so much. This has been a great interview and time with you as well. I love the passion. So,
All right.
everyone, thank you for your time today. Well, that's our show. Please like and subscribe on Apple Podcasts, Spotify, Stitcher, and wherever you listen to podcasts. Thank you all for being on this journey with us toward better patient health. Take care.